Good morning, everyone. It's 9:30. I'm going to get us started. It's been 2 weeks now since I've had a chance to talk, so I certainly want to have time to hear from everybody about how things are going there. I have a couple of updates to start with. Get my screen to advance here. Okay. So for updates, I assume you all got the blood pressure and A1C jot form that I'd like to get in by June 20th. Thank you for everybody who's gotten those in already. That's super helpful. I do realize that data is going to have a lot of holes in it, and it's challenging right now to be getting that information from folks. I also wanted to update you on the plan for supplies. So we have ordered, and I think most stuff has come in. We've ordered blood pressure cuffs, thermometers, and O2 sat equipment, and so that's all is being shipped to Cathedral Square, and we're going to either mail it to you or deliver it by car, and that's going to be happening at the end of June, around the week of June 20th. We'll get more details to you. So that's all been ordered. The current plan is that each nurse will get a minimum of 2 blood pressure cuffs. Everybody's going to get 2 O2 sat monitors and 1 thermometer, unless I've heard from you that you don't need that. So I know several of you have multiple panels and have requested additional blood pressure cuffs, and there may be extras that I will get to you, and we may be able to order additional ones too, but we're trying to figure out exactly how to spend the funds that are available. Which leads me to the next update, which is that, as you know, there are more and more online classes, and some of the self-management classes are being offered, including the diabetes prevention program and diabetes self-management classes through Vermont, myhealthyvermont.org. So definitely try to refer people to those. I know that requires internet and Chromebook or some sort of tablet to be able to attend those classes. There's a possibility of some funds to be able to purchase tablets or Chromebooks so that our participants can attend those classes. So we're working on that. That may be coming. So keep in mind as you find people that might really benefit from a DPP class or a diabetes self-management class, that there may be some potential to help them with the tech part of it. And just keep those in the back of your head for when that gets rolled out. I'm going to check in. I'm assuming everybody's hearing me okay. I'm not seeing anything in the chat saying, where are you? So hopefully that's the case.
We can hear you just fine, Casey. You're good.
Okay, thank you, Amy. I feel like I was talking to myself for a minute. Update on foot care. We are working really hard to put together some changes to the foot care in SASH, and I'm not exactly sure how that's going to look like. I can tell you that foot care will not be required. You do not have to start doing foot care, but for SASH nurses who already do foot care or who are trained in foot care and want to be providing foot care, that we're going to be allowing nurses to do that. And what we would really like to hear from you guys is, do you want to do it? Do you have the support of your employer to do it? And what do you need to be able to make that happen? So maybe you're really interested in foot care and your employer's okay with it, but you've never been trained. So that's what we want to know about. What do you need for equipment? That kind of thing. We're working on that as quickly as we can. I know that foot care is a huge need for participants right now with all the foot care clinics canceled around the state. So not really any huge change there, except that SASH is kind of endorsing it in a different way than we have in the past because of the need. So you can certainly chat in, or when you give your updates next, you can talk about it or send me a private email. But I'd love to hear what's going on and what your thoughts are on foot care right now. really want to encourage testing of staff, either nurses or anyone you're working with, to if people are attending the protest or any other large gatherings or traveling to high COVID areas, that they should get tested. And the current guidance is 3 to 7 days after attending those events that you should get tested. There's definitely concern that those could be seeding events for the virus. So getting tested to prevent spread to our participants and to coworkers. And then finally, some guidance from a training I was at around how to handle participants who can't wear a mask. So either they can't tolerate it because it makes them too anxious or too short of breath. So when a participant can't tolerate a mask, staff should be wearing a mask and a face shield. So we're wearing a mask to prevent us from spreading the virus, and then we wear a face shield to prevent getting the virus from somebody who isn't wearing a mask. So that's the current recommendation, and that came from HUD, mostly around because we can't refuse to see someone who can't wear a mask, and the people who can't tolerate masks are possibly our highest risk folks and the ones we maybe need to see the most. So that's some guidance on mask use. Sarah's asking if we have face shields. I know face shields were requested from the Vermont Department of Health, and some sites got them. So I would check with your supervisor, with your team leaders, but I believe Cathedral Square has face shields that are available for folks. Any other comments on this before I jump into check-ins? Okay. All right. So I'd love to hear from all of you about how things are going. You're certainly welcome to bring up anything that's on your mind, but kind of my questions are where your panel is at currently and how's it going? How and if your panel is preparing for an outbreak in your area. I think the Winooski outbreak that's happening kind of highlights what the potential is over the next several months for these isolated outbreaks, which could certainly affect each of us. How you're using and preserving PPE, and if and how you're supporting participants with telehealth at all. So let's see, Sarah, can we start with you with an update?
Yeah, that'd be great because I have to leave early too. So can you hear me?
Yes, we can hear you. Go ahead.
Great. So phase, our panels are in. So I'm in Grandway in South Burlington, and then Thayer House off of North Ave in Burlington. And Grandway, I think we're in about phase 2. At Thayer House, it's a little closer to Winooski, and so we're kind of, actually, I think at both sides, kind of reeling back just a little bit, not really making any major changes, but kind of maybe slowing down the reopening of some even outdoor events for that participants or residents want to have. So just kind of pausing as far as the Winooski outbreak. Things are going pretty well otherwise. I mean, people are still, wanting to do more, wanting to use the common spaces, and it's, sort of the messaging around how do we, talk to them about that, empathize, so just keep everyone safe. And preparing for an outbreak, I think, I don't know if, some of the scenario planning that Ann and I were doing, I think that's a piece, and talking to the coordinators a little bit more about kind of the discussions of what went well, what didn't go well, kind of what you proposed on the last call, Casey, is something that I've brought up, and we're kind of still going to have those conversations. So I think just keeping open communication, but we haven't necessarily done anything in particular to prepare. besides kind of pausing. And about PPE, I did, so I'm not on site yet, and that I'm thinking of the time when I'll be back, at least part-time on site will be the end of the month or beginning of July. So some of these questions about PPE are coming up for me more now. And I'm very curious. What I'm finding as I start to wear a mask more, just in kind of realizing that there's a lot of different types of masks, and some really don't work well. They fall off, some do. Some you can't breathe with, some work, so I'm actually looking for any recommendations of brands of masks that people are finding really helpful and fit well and work well. And also I'm wondering about uh, disinfectant wipes and sort of the cleaning of equipment for in-person visits, or even like a vitals check if they're outside or, in the nurse office. When I asked at one site, there was like one bottle of a disinfectant that sort of was used for like all the coordinators and the nurse, and then there were alcohol swabs. So I would request to have kind of one for the nurse that they get to keep with them when they're on site. We were thinking of maybe just like getting a new empty bottle and pouring some in for the nurse. But I'm just wondering like what people are doing for that, and kind of what would work best, what's working best for people. Telehealth. So not doing a lot of that. We're definitely helping with care coordination and coordinating some of those calls. I know there's been some use of coordinator computer, laptop, kind of setting it up in a safe space, doing that sort of thing. So we are doing just a little bit of that. And that seems to be helpful, especially when there's one participant in particular that she's been really hard to get a hold of, and she has major health issues going on right now. So that's been really helpful to do that. And if, PCP clinics who still are not seeing people in person, which is happening, for another person, we're setting up another call with a SASH coordinator computer. So a little bit of that going on. That's all for me.
Thanks, Sarah. And I just wanted to say to the mask question, I think it's totally appropriate for the nurses to be wearing cloth masks at this point. And if you can find a cloth mask that you're really comfortable with, because they're reusable, they're washable, and that may be the most comfortable. I agree, and I'm definitely hearing from a lot of people that the surgical masks are so cheap and so flimsy that they just fall apart really quickly. But I'd love to hear from other folks what they're using and how it's going. And the disinfectant is certainly a challenge. We were hoping to purchase disinfectant to go with the blood pressure cuffs and the O2 sets, but it's just not available. It's just not out there. So I think communicating with your maintenance staff at each site, and I totally agree with you that the nurses should have their own bottle there. But I'd love to hear how other people are handling that. Anne, can we go to you, Anne Anderson?
Yep.
Okay.
So I kind of lost you. I lost my connection a minute ago, so I'm back on though. So I missed everything that Sarah was saying. But as far as what we're currently doing, Tuesday for the first time I went up to one of our sites, and it's senior housing, but there are like individual like apartments. They don't have a main lobby they go through. And I just went to the back of the apartments, and they have sliding glass doors, and just kind of talk to people through that, a couple people. So otherwise our LUMSAC panel has not started, making visits. So we really haven't talked about an outbreak in our area. I don't think we've had any participants. And I'm kind of speaking for the other panel also, but I don't think they have either. So we haven't had any COVID cases. So, and when I do make so I work for the VNA, so I'm just if I'm going to make any visits, I would just follow what we do there, which is a mask and gloves if I have contact with somebody.
And Ann, is that sort of surgical mask?
They're surgical masks, yeah.
Okay.
Yeah. So, and I haven't done anything with telehealth. You have to be seeing somebody to do that. So, we haven't really done that. I think we're talking about maybe in the next week or two starting to go into the buildings and our coordinator, we have different offices, so but trying not to be there at the same time, that kind of thing. So
Great, thank you. Hillary?
Yep. Can you hear me?
You can, go ahead.
Okay. We're doing pretty well. We're still on phase 2, going into phase 3 next week, I think. It's going okay. I think the participants are really hot to see us. So we've been seeing people sometimes in a community room as long as it's distance and with masks, and talking to folks, but not only if they really need to. We're going to start making appointments next week. As far as preparing for an outbreak, I think we're just preparing. I mean, we've got what we have, and we haven't had anything so far, knock on wood. So I'm not really sure where that's going. I think everybody in all the panels that we use here in the Northeast Kingdom, and I don't see any of the other nurses on because we have another meeting at 10. We're all using either surgical masks, or if they have their own N95s or cloth masks, and wearing gloves as needed. I think everybody's trying to be really careful. Rural Edge has been really good about, giving us sanitizer. I know our boss, Gary, has been, he has spray disinfectant that we're using along with paper towels in every single office. So I think that's going pretty well. And nobody that I know is using telehealth as yet.
Great, thank you, Hillary. And I think I would encourage, just because of my knowledge of the Rural Edge panels, as you're thinking about outbreak kind of things, like if there is, say, an outbreak in Newport, how does that affect your panel, or how does that affect Bradford? And just thinking through or talking through some of those possibilities. Do you close down all of the panels because there's an outbreak in one section? And that's what I'm struggling with a little bit in Burlington with the Winooski outbreak is, there's an outbreak in Winooski. What does that mean for Grandway, or what does that mean for Fair House? And so just thinking through some of that ahead of time so we can be as proactive as we can, because who knows.
I will bring it up at the meeting this afternoon, which I think you're going to be on, I think.
Yeah.
And because I think that's something that we really need to talk about. So I thank you. Yeah, that's because, again, we're all just, it's kind of like, we had talked about it a while ago that, if anything happened, we would just go back to like total quarantine in our particular panel or that particular building. But I think that's a really good question. So we will talk about that this afternoon. Thank you.
Okay. Thanks, Hillary.
Yep.
Jenna. Bye.
Okay.
Hi, everyone. Hi. So, yeah, here in the Brattleboro area, we are going into phase 2, starting on the 15th, so on Monday. And it's been just a lot of collaboration. We've, the SASH implementation manager and myself, we took a lot of documents from SASH and just put together a re-entry plan for our panels and, different scenarios that could come up. We kind of reviewed, like we have a COVID-19 pre-screening for our participants and staff, a visitation log to keep track of, who we're seeing, when we're seeing them, and then using, the SASH decision tree, PPE. We also sent out a notice to SASH participants as well as our partners, partner agencies, and also put office signs up that were necessary. So we're going to start to have office hours at one of the sites for short periods of time. And we're trying right now to see participants mostly like in a designated area outside the office and not necessarily have them be in the office. So we'll see how that goes. I have my first in-person visit next week on Tuesday, and it's just been a lot of, just communicating with partners and, with SASH staff in terms of, so that is happening. I think for me, I also have concerns, as you have mentioned on there, just with the protests that are going on and noticing a lot of people from out of town, especially coming, I know, here in Brattleboro, and seeing people outside congregating, not, doing social distancing or wearing face masks. So just getting more lax about things, it seems like, in this area. And so really it's just going a day at a time, I feel like, in terms of, looking at the cases, getting updates from, the Vermont Department of Health and CDC, and just seeing where the cases are and if there is, a surge that does happen, and then just reevaluating. So I think communication is really key. And in terms of PPE, we do have quite a bit of PPE. I think the only thing we don't have are gowns. So if that ever was necessary, I actually have an apron, or we brainstormed even like a poncho if we had to use something and didn't have, medical gowns. But again, that'd just be very specific cases where we need that. Also bought some paper bags just so that we can put the surgical masks in for 5 days and then reuse them. And I actually went to different stores because we really needed like disinfectant wipes. So I did find actually quite a few disinfectant wipes at a store. It's just Lysol and Clorox. So I was grateful that we found those because we didn't really have much. And in terms of with supporting participants with telehealth, right now, our hospital and a lot of the outpatient services have been opening up since the end of May. So definitely encouraging participants that if they need to be seen, just encourage them to make an appointment. Some providers are still, they're just assessing whether someone really needs to come in or not. And then oftentimes they will call. And I don't have many participants who are doing like video telehealth or know how to, set that up. But again, just encouraging them to get the care that they need. And let's see. In terms of getting tested as well for COVID-19, there's a lot of pop-up tents and testing taking place for, people that are asymptomatic but want to be tested. And so that is an option, and you can just go on the Vermont Department of Health website, and there's different sign up for different areas in Vermont. And the last thing was with respirators. So we did receive some N95 respirators. And in terms of fit testing, that was one question I wanted to bring up. I've asked this question at an agency meeting that we had, as well as at the hospital, but there was no real response of, yes, this is where you can get fit tested. I know that's important to do, so I'm just wondering how other people are going about that. I think it's important to be prepared and make sure you have the right, respirators if you actually do need to wear one. So I'll just present that question, to people.
Great. Thank you, Jenna. And yeah, definitely, if anyone has experience with getting fit testing, I know, and we've had fit testers come to the memory care in Burlington, and some of the SASH nurses came to that and got fit tested. I'm not sure what else is available elsewhere in the state. So if anyone else has been successful, please chime in either in the chat or when you report out. I also wanted to say that the memory care did way back in the beginning purchase ponchos, and so that's for basically for a nursing home, but that's their backup plan is ponchos.
Yeah.
So that's definitely appropriate, or
Exactly.
definitely being done. So, yeah.
Yeah, and the last thing I'll mention real quick too is that we have not had any COVID-19 positive cases
Right.
within our panels. Yeah.
Right. Good. Okay. Jenny?
Good morning.
Good morning.
There's some landscapers in my yard, so it might get really loud if they get close to the window. I apologize if that happens, but it's clear right now. So, so I'm at 5 properties in Chittenden County, and I would say all of them are probably in about phase 2. I have been going in to all of them just for like shorter hours, and mostly like a closed office, but it is really nice to be able to see people because people are out, outside or in the hallways, so I can at least like have a casual check-in with them. And that has felt really good to just like see their faces or at least their eyes again. And I have been doing some visits, mostly with hospital discharges. And the good thing about those is that everyone who's been in the hospital has been tested for COVID before they send them home. So you know that they're clear when you're going in to see them. And I'm just taking a lot of precautions, going through all of the questions. We both wear masks and gloves. I don't touch anything in their homes. If I am doing a vital check, I'm using spray to like clean everything down. And I would say my panels are pretty prepared for an outbreak because we did in the very beginning have one COVID positive case in one of my buildings. So at that point, we went through the whole protocol of what would happen if more residents were tested positive, and luckily we only had the one. So I think we've got that down. That was a scare at the beginning, so we kind of figured it out quick. And yeah, like I said, I'm using cloth masks and gloves. We haven't used like the full gowns. That hasn't really been a need yet. Some people have been coming into my office. I have a chair that I can totally clean, and that's generally to support, not necessarily with telehealth, with like the virtual appointments, but a lot of my participants are doing phone call check-ins with their doctors, and then the doctor wants a set of vital signs. So that's, I would say, how I'm mostly supporting with that. And these were all, it doesn't sound like many other people are seeing people this much, but this was all approved by my team leader. And, it's nice to have them come to me because I'm really in control of the space then too. And we're limiting it to like 5 minutes. So I think that's probably about it.
Great, thanks, Jenny, and it's great to hear how you're supporting telehealth. I think that's great, and I'm sure that the participants appreciate you being there.
Yeah,
Awesome.
it feels really nice to see them. It's not the same as just talking to them on the phone,
Right. Absolutely. Yeah. Okay. Let's see. Catherine, our next. Yeah. Catherine from
Hi, good morning.
Minnesota. Good morning.
Good morning. Yeah, so luckily it's a little bit quieter as far as Minneapolis here. I actually live in Northeast Minneapolis, which is just a couple miles from all the protesters and violence and all that stuff, and that was really tough. It's I think it's a little more peaceful right now, but one of the buildings in Minnesota, we have 5 sites. There's 2 coordinators and 2 nurses, and we have 5 sites. And I have 3 of those sites, and 2 of them I have not been to. I only go on Fridays to one site, and we've all been assigned just one site throughout this whole time. So 2 of the St. Paul sites that I'm not in, but we're doing everything by phone, they were super close to like the targets that burned down and things like that. So we've had to help people readjust their prescriptions and pharmacies, and some people were waiting for meds, but they're in the burned down Target buildings. So we've had to call psychiatrists and doctors to reorder prescriptions, and so it's been really interesting, just kind of messy and kind of lots of just different random situations for each site. But we've been doing reassessments. We started those, and we're doing all those over the phone, and not quite a quarter of the way through my group of almost 100, but that's going better than I expected, so I'm grateful for that. We're following a lot of the rules with each housing director at each site, because they're the ones that put signs up and make the rules, and all their sites. At least the site I'm in on Friday, everybody's required to wear a mask if they're out of their apartment. Some of the sites are starting to allow 1 visitor per day. That just started this week. So we're not going in any apartments. Even when I'm on site, I'm still in my office, but having some social distance masks, visits as far as like check-ins and such, and reassessments are all, like I said, on phone. I did one in a room socially distanced at 2 different tables and such, but yeah, otherwise they're short visits for sure. So, and we're doing the cloth masks, and we'll be having discussion today. Hannah, our team leader, she just came back from maternity leave this week, so we're kind of, I think, in transition of, okay, what's next and all that, but things are going, I'd say, pretty well considering all things, and so far no COVID in on any of our SASH people, but there is COVID in the 2 St. Paul sites that we haven't been at physically, so, but not in the specific building where our SASH people reside, in an adjacent building. Did I answer all the questions? Sorry, I wasn't looking at the list of questions.
Yes, thank you. And yeah, I'm so glad you have been there for your participants through all of this. I imagine you have a more diverse population than we do here. A lot of our panels.
Definitely.
Some of our panels.
Yeah, it's been really busy, really busy. Yep.
Yeah, I bet. Great, thank you.
Mm-hmm.
Kathy Schuster, can you give us a report?
Hi, yes, I'm at Valley Cares in Townsend, and we are in phase 2. I am anticipating returning to the site within the next week or 10 days. Tested myself. Also, we are fortunate at the moment to have had no reported cases, in our panel. We are very grateful to, I think it was Anne, the Allard Square template model that was brought forward in the last month, that was presented at one of our gatherings. I found it really helpful and shared it with our coordinator, and she, with her tech savviness, we've kind of moved forward and actually created a template in the event there were a possible outbreak, and we are actually going to share that with our advisory council this coming week and get their feedback and insights and updates on how this might be used and in the event that we did have a situation arise. So again, I'm very grateful to that model, and hopefully it will serve as a guide to us, and also very looking forward to getting insights from our panel who are working in a variety of organizations that might have some insights on what we might need to add or utilize with that. So that's really helpful. As far as PPEs, again, it's pretty much we're pretty set. We're fortunate to be affiliated with an assisted living facility. And so with their focus on, they have the medical model and are very much having to manage, this aspect, very consistently. The biggest concern, unfortunately, that we do have as well is gowns, and they have had difficulty getting gowns for their staff for their care, but we do have their support, so that's been really helpful. As far as telehealth, most of our participants do not have internet in the small, at least on-site facility. So they have done teleconference calls when needed with their physicians, but we really haven't had to use that on site yet. So overall, yes, I'm looking forward to just going back and being in the space, the office. And we're going to coordinate, the coordinator myself, so we probably will not be there at this point in time together and having to work that out. But yep, that's the update from our end. And, just overall, I think the folks there are kind of getting, they're kind of wanting to break out of kind of being kind of connected and feeling like they're tied down still to their apartments as much, even though they're outdoors now. And I talked to one yesterday, and he's gardening, and he's got a couple of garden spaces, so he's found a little niche. But people are, I think, anticipating a little bit of relief with being able to be outdoors a little bit, social distancing. And I just had one question. Folks, if they've had any insights to participants that are saying, they really can't wear a mask, and they just really feel they don't have to, and sort of how people have guided that conversation going forward, and sort of how that's played out, particularly in common space areas that they might be involved with other participants in. So just any thoughts on that?
Great. Thank you, Kathy. And I'm glad that those tools that we shared were helpful. And I'd love to see what you guys came up with as well, if you're able to share that with me, just to see if there's ways we can fine tune the tools or what different folks are coming up with. Love to see that. I know that the mask issue is definitely coming up in lots of places. So if folks have ways they've handled it, please chat that in or share it. And I know that the kind of the messaging around requiring masks to protect other people is kind of is the best tool that we have. Then it's not about you, it's about protecting everyone else. It's become a very political issue. It's become it's also challenging in that we're a very individualistic society. We're thinking about the public good is not necessarily something we're super familiar with. So if anybody has ideas or things that have worked for them, please chat them in, because I think that's an issue for everyone. Thank you for bringing that up, Kathy. Kathy Taylor.
Good morning.
Good morning.
Happy to report that my coordinator and I are starting to see clients, and we have to be outdoors. We cannot be in the buildings per the housing trust that we work with. So we saw 3 participants yesterday. One that I'm now giggling about because she needed foot care, so I met her in the Rutland parking garage in downtown Rutland, and we did her feet. Then another gal we saw in a gazebo, and another gal we saw on the front porch. So we are able to see people. And one of the issues that came up with all 3 of them, which I found interesting, is that they put off calling their physicians or nurse practitioners about persistent problems they've been having. And so I encouraged all 3 of them to call their PCP and discuss their problem. And I'm going to follow up in a week's time to make sure that they did this. I'm having some issues myself with disinfecting equipment. So I'm thinking about ways in which we're going to be able to do that. Personally, I prefer a surgical mask. I do not like cloth masks. And I was really concerned about yesterday being very hot and humid, but as it turned out, we had a nice breeze, so we made it through the day without any difficulty. We were able to do 2 of our assessments and start catching up on those. I believe that we have plenty of masks that have been provided to us by the Housing Authority down here in Rutland. And I'm putting mine in brown paper bags and reusing them in 5 days and labeling the bags. As far as an outbreak, I think we would just back off. We would no longer see our clients and be doing everything by phone again. One of the clients had an appointment by telehealth with her PCP, and that went well. 2 of them did not receive results from recent labs that were drawn, so I was able to pull up Cerner from Rutland Regional and discuss their lab work with them. And I'm just overjoyed that we're back with these folks that I've missed so much. And that's it from me.
Great, thank you, Kathy. Yeah. Definitely, I would encourage everyone to keep their eye out for sanitizing wipes. It is tricky in that there's things out there that say they're sanitizing wipes and aren't necessarily, but that's something we definitely need to keep working on. Linda, are you able to give a report? Go ahead, Linda.
Yeah, good morning. Yes, we haven't actually started doing our reassessments actually face-to-face. What has been happening that when we're contacting our participants of getting a feel how they feel about it. Are they comfortable with it? Do they have a mask? And kind of explain the process that we'll be going through if we do come to visit them face to face. A lot of them have support people. So, we just want them to run it by 2. So everybody's on the same page about how comfortable they are. And again, making them aware that they are discussing outbreaks in the future. So we just want them to be knowledgeable and comfortable when we start to come in. Making sure they have masks, and at visiting nurses, we are supposed to be having meetings about opening up the public foot clinics and the procedure that will be put into place. That hasn't really been discussed yet, but so it's nice that some people are getting that service that need it. Not too many more of our folks have had the telehealth. They have actually had their appointments and had lab works done, and an MRI, an EEG, just other labs that were ordered, and everybody seems to be comfortable. They seem to be okay, and I think they're anxious to move on a bit more. But some of the folks have done the telehealth, and they did well. It was just the phone. They don't have computers or smartphones, but it went well. They didn't seem to have an issue with that. They were comfortable with that. So I guess that's where we are right now. It's gradual, but it's okay. We just want them to be comfortable when we get to that point. So that's it. Thank you.
Great. Thank you, Linda. And certainly if you learn anything about what's figured out for foot care clinics down there, if you could share that with me, that would be great. If they have certain procedures they're going to follow, or as we're working on this foot care for SASH, it's certainly not going to be for people who have access in another way. It's only for folks who really can't access it. But I'd love to hear how they're doing it down there.
Okay. Good. Thank you.
Melissa. Yeah, thank you. Melissa?
Yep. Hi, everyone. This is Melissa, and I'm in Addison County, Vermont. I think we're in phase 2 right now. With 2 of my panels, the SASH coordinator has been going to the office all along. One panel is totally community-based, and the other panel, the coordinator has started back into phase 2. I've started phase 2 as of June 1st, but it's going pretty well. I think the biggest issues are reminding those that do not have masks on that, I kind of ask them as well, where's your mask? And they'll either say they don't forget, they forgot it, or I have a couple who refuse to wear one, and I just remind them that it is important to use it when they go into the community room, especially. As of now, we don't have any known active cases of COVID in our panels. We do have that one death in our community-based panel back in early April. We haven't really done any preparation for an outbreak. My plan this week was to kind of take that template that was offered to write down names and phone numbers, but I haven't had time to do that yet. As far as actually going into the office, I'm wearing a mask all the time, except if I'm in the office, then I take it off. I put up a note of my office hours, so I'm in each building for a couple hours, that I'm available to do outdoor visits. And some places I've been keeping the office door open, and people will stop in the hall, and I chat with them. And obviously, if I've got the door open, I have my mask on. I've done one visit, a home visit, but we met outside. The participant wanted a blood pressure check, so I had on N95 and a face shield and gloves. Then stepped away. I guess my concern with the PPE is the disinfecting, having enough wipes, and then also something to put down on wherever I'm putting my equipment that is clean. Like something to put things down on. What else? I'm looking at the list here. We haven't really done anything with telehealth. When I've talked to our participants, it's been a variety. Some participants are still doing phone call appointments. I've had some participants who have gone for appointments. Others I've heard of about a blood draw that was actually done while they're sitting in their car, while others have been sent to the hospital for for blood work. But, overall, I think things are moving along pretty well. And I think I foresee the future with our rural panel, probably starting to make home visits, maybe even today, outdoors. And we're not doing any home visits in apartments, other than knocking on a door and talking, out in the hallway or in a quiet area where, we can have some privacy, but certainly not going into the home per se. I think that was it.
Great, thank you, Melissa. I agree that having something to put things down on is going to become more and more important as we start going into people's homes and just need to be able to set our blood pressure cuff down. Or I think it was Gretchen who was talking about that they have like chucks or that they use, and it's disposable each time. So yeah, another piece of equipment that it would be great to have, and something to research a little bit as to what we can use for that. Is there anyone I missed? I think I got everybody, but chime in if I missed you. Got a couple more slides of things to share. Catherine shared this with me of different pictures of some different dermatology manifestations of COVID-19, which I think is just important for the nurses to be aware of, that as we know, this is it's presenting really differently in people. So, seeing somebody with a funny rash wouldn't necessarily trigger us to think COVID-19, but I think as this slide demonstrates, it probably should be something that people should be either talk to their primary care or get tested, because these are some of the symptoms that are being seen out there. So thank you, Catherine, for sharing this. And Anne chatted in that that the VNA in her area is using dental bibs, that she has seen them on Amazon. So using dental bibs as a surface to put things down on. So thank you, Anne. That's helpful. That seems like the right size too for what we need. That sounds good. Okay. Wanted to mention, as I assume a lot of you are following the Vermont Department of Health updates and their health alerts, they do have a pretty robust tracking system that's being used, that they're using, and as part of that, they have a SARA alert system. So people who test positive they're being asked to sign up for the SARA alert system, which triggers them to monitor their symptoms every day and report on those symptoms as a way to track people, both who test positive for COVID and also for people coming into the state and who are under quarantine. They can also sign up for SARA alert, and that just tracks their symptoms, part of their contact tracing setup. So if you're hearing about the SARA alert, that's what that is. It's not a GPS, so it's not following people around. And it's totally voluntary, my understanding, even for people who test positive, but it's a way of tracking symptoms. They're also planning on giving O2 sat monitors to anyone who tests positive. And I believe that's going to be through the primary care, but with the idea that people who test positive can then check their oxygen level on a daily basis and hopefully catch a decompensation in oxygen earlier and get them into the hospital earlier, because that was definitely connected with mortality rates. Is folks just coming to the ER really late and already have very low oxygen levels. So that's part of why we're only giving the nurses 2 O2 sat monitors to loan, is because the Vermont Department of Health is going to be loaning them as well, or maybe they are giving them. I'm not sure. We need to loan them. but certainly, as we know, we've had a lot of participants who we're pretty sure have COVID but are testing negative, or who are refusing to get tested, or are waiting for test results. So I anticipate if there is a lot of cases that they might not get. We might be useful in getting O2 sat monitors to people who need them. So you will be getting those. Let's see. Putting together, this is still a draft on screening questions that I think that a lot of you probably are getting screening questions from your supervisor and say, this is what we're using. But in case people are not, this is based on what Gretchen shared with us a few weeks ago from UVM Health and Hospice, and changed it just a little bit to be more for SASH, but that we are self-screening ourselves before we go to work every day. We're kind of asking ourselves our own questions, making sure we're not sick in any way, checking our own temperature. And I think it's important to say to participants as before we screen them that we are also self-screening. I got my temperature checked today. I believe I'm healthy to see you, because this goes both ways. And as several people have mentioned, explaining that you're going to be wearing a mask and that you're asking them to wear a mask. And again, if they can't tolerate it for some reason, then wearing a mask and a face shield to visit the participant. My understanding is that home health is not necessarily wearing N95s or face shields or any of that more difficult to get PPE unless they have somebody who is positive or who screens positive on this questionnaire. And so, it's not necessary to wear an N95 to visit someone unless they're screening positive on this questionnaire. So the questions, if any of these are a yes, 1, 2, or 3 are a yes, then we need to really think about whether it's essential for us to visit them, encourage that person to get tested, get a supervisor approval, and certainly make sure you have the right PPE, like a fitted N95 mask, gloves, face shield, gown. And also, if you're visiting someone and they start to exhibit these symptoms, like coughing a lot, or then we should be immediately ending the visit, washing our hands, contacting our supervisor, and following up with that participant by phone and encouraging them to get tested and contact their PCP. So we're gonna share this on Monday with the COVID call. And Catherine is asking if I can share this slide, and I certainly can send this on to you. It is in draft form, and I mean, every employer can tweak it to their own for their own use, but this is a recommendation for what we should be asking. I think it is interesting too that the CDC guidelines is 2 or more of the following symptoms. So somebody just having a fever, according to the CDC guidelines, doesn't mean they're isn't triggering a positive screen here. So I'm sure that I think that's interesting because that's what we're using for staff is a positive fever would mean we don't come to work. And once this is in the final format, we'll get this up on STAR as well. But certainly if somebody needs it sooner, let me know and I can pass it on to you. I shared this on the last call, so I don't think we need to go through it again. But what I did want to mention, which several of you I think are already doing, is just thinking about what might be coming. Hopefully we're going to have that slow, gradual burn where we have tiny peaks in different places and it goes away. That's the hope, but that still may be over the next year or two. So really thinking about and talking about what tools work best, what do you need going forward, what do you need if there's an outbreak in your area like what's happening in Winooski right now, and talking through that as a panel. That is everything I have. So thank you all so much for joining. And this is recorded. It will be up on STAR. those JOT forms into me, and please let me know your thoughts on foot care. And we have our next call in 2 weeks. So thank you so much, everybody. As always, I'm going to stay on for a few more minutes. So if you have other things to chat in, I will be here for a few minutes. Have a good day.
Casey,
Yes, go ahead.
it's Kathy Taylor. Is there a commercial disinfectant spray that is effective against COVID, such as Lysol?
There are, and there is some specific OSHA guidelines on that. I think that probably your maintenance person would be the best person to ask. You can make a bleach solution as well. That's very simple to make. I think it's, I don't want to quote the percentage because I might get it wrong. The issue what I learned about with the bleach solution is it's only good for 24 hours. So you make it, you use it, and then you have to get rid of it in some way and make it again every day, which I didn't know. But I think that maintenance should have the OSHA guidelines
Okay.
on what to use.
Thank you very much.
Yeah, thank you.